probably no surprise to hear about these levels of circulation. Everybody knows somebody who's sick right now.
Canada continues to see an increase of influenza activity right across the country, according to the latest National Flu Watch data, and it is impacting young children and older adults. Between November 20th and November 26th, 8,226 influenza cases were reported, compared to the 5,800 cases reported the week before. The hardest hit provinces, according to the data, were PEI, Alberta, and British Columbia. Winnipeg epidemiologist Cynthia Carr says the dominant strain right now is called H3N2, and historically this strain is connected to cases with more severe outcomes in vulnerable people.
When we look at our most recent Manitoba data, for example, we can see that our kids account for about 15% of flu cases that have been sort of lab confirmed, but they're 25% of the hospitalizations. So they're quite overrepresented in terms of the percentage of cases versus severe outcomes.
Around 46% of the cases reported across Canada were under the age of 19, but those experiencing more serious outcomes from influenza were children under 5 years of age and adults 65 years of age and older. Since the start of the influenza season in August, there have been 707 pediatric influenza-related hospitalizations and 95 ICU admissions. Children aged 2 to 4 and 5 to 9 years old account for more than 50% of the reported pediatric hospitalizations.
It's very important to remember that 6 months and older is the eligible age for the influenza vaccine, and it's very important. So again, 25% of people in the hospital right now with influenza are children.
The report indicates the current influenza illness rates are above normal seasonal levels, including the rates for cough and fever among Canadians. Flu cases continue to rise in Manitoba, according to the provincial government. Respiratory viruses continue to be a major cause of children's hospital visits. Carr says it's important to take every precaution possible to avoid getting sick.
Wearing a mask will offer a layer of protection. If you are sick yourself, please stay home. If your children are sick, please keep them home again, because the more people that are out and about with the viruses, the more we're just passing it around. And there's, again, significant impact from COVID, from RSV, and from the influenza.
In Winnipeg, Alex Karpa, City News.
Next on City